Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Thyroid cancer, and you're looking at the gene alteration. So, in terms of the papillary carcinoma. So, here in papillary carcinoma, it is the BRAF mutation, and there is also the involvement of RET or the PTC rearrangement. Next is the MET. There is also the presence of the NTRK1. NTRK1, this is nothing but the fusion gene, as well as the GDNF. So what is GDNF? GDNF is the glial derived neurotrophic factor. So it is a glial derived neurotrophic factor. Next, there is a follicular carcinoma. So as per the follicular carcinoma, the RIS mutation is present. Then the PIK3CA mutation. Then comes the PTEN mutation. And the PAX8 and the PPAR1. All this PTEN mutation and the PAX8 and the PPAR1 fusion gene. This is under the follicular carcinoma. Next, under medullary carcinoma, so under this there is the RET mutation. And then looking at the follicular adenoma. So follicular adenoma, it includes the TSHR. So TSHR mutation. Next is the GSO. There is the GSA, GNAS mutation, the RAS mutation. The RAS mutation, so here it is less than 20 degrees Celsius, 20% of the cases. Next, we see the PAX. So follicular adenoma, there is a TSHR mutation, there is a GNAS mutation as well as the RAS mutation. So RAS mutation, as we saw, it was less than 20% cases. And then is the PAX8. There is PAX8 as well as the PPAR gamma 1 fusion. So this is seen in less than 10% of the cases. Next is there is presence of the PTEN. So all this is under follicular adenoma. Lastly, there is anaplastic carcinoma. So under anaplastic carcinoma, there is a CTNNB1. The CTNNB1, that is a beta catenin, and also the TP53 inactivation. To learn and grow daily like this, please do subscribe.